Many people have asked me, what's causing my neck pain? You know, I wake up in the middle of the night and I have it, or I wake up in the morning I have it, or by the end of the day I'm really suffering from the neck pain, my shoulders are up. What's causing this? Well, a lot of people have a lot of different problems, but there's several that are very common. One is what we call now is tech neck, which is anterior translation of the head from your shoulders. So if you have your normal posture, your ears over your shoulder. But if you just translate a little bit, your shoulders will roll forward, hiding it. But just 1 inch forward, your 12-pound head weighs 24 pounds as the muscles and ligaments hold it in place. And even more importantly, you're putting a shear force on the spinal cord itself. Also, if you go 2 inches, now your 12-pound head weighs 36 pounds to the muscles and ligaments hold it in place, and you put even more force through the spinal cord itself. What causes people to have tech neck? Well, the obvious one is technology, computers, phones, because we be on our phones all the time, looking down either playing games or doing stuff, or gaming either a console or on our phones. Loss of the cervical curve affects not just your neck, but your whole body, because your neck connects your brain to your body. So as far as what happens when you go to tech neck, you can have the shoulders coming up, you can have the pain down the arm, you can have pins and needles, if you will, or lose your grip on a simple cup. And that's just from driving your head forward and keeping it there over time. Yes, we are made to be able to do that temporarily, but it's when it's all the time is when you start having damage done. Another common problem that we have with neck pain is disc problems. That can be bulges or it can be herniations. A normal disc is you have the outer part and then you have the nucleus in the center. The outer part is sort of fibrous tissue and then the nucleus is more liquid. If it stays in the center and everything stays good, then you have a healthy disc. However, when you have a bulge, the disc outer covering expands, but the nucleus stays in the center. And then worse is when you have a herniation, because now the nucleus is ripping through the annulus, which is what this is called, the actual outer covering. It's causing a herniation right here, causing direct pressure on the nerve root. Either the bulge or the herniation can have very similar symptoms. A lot of times there's no difference between them. They can go down one arm, they can go down both arms, and they can cause pins and needle sensation. They can also cause lack of feeling or muscle weakness. This is called muscle atrophy. Either one, they can be treated by the adjustments and traction and home exercise so we can get the pressure off the nervous system and get you back to health and vitality. But we need to know exactly what we're dealing with, so that's why we do the examinations and the x-rays and all this other stuff that people say, why are you doing it? Is to help you with your life, because your life is so important. Then we have degenerative disc disease. Well, that's another one. But now you have not just the disc problem, but now you're starting to get, but you're starting to get the arthritic change. Instead of having a nice clear joint here, you have one that is now arthritic and is sort of clawing together. Your body's trying to freeze that joint until it gets to a point where it is frozen, and we call that a fused joint. We don't want a fusion joint because that is completely compromised the nerve. So even if there's osteoarthritis, which is what this is, we can still work with it as long as there's some disc space there to help reduce the damage doing to the nervous system. Last one I want to talk to you about today is whiplash, or auto accidents, and also happens slips and falls, or falling down the stairs, which some people have had happen. What happens there in an auto accident, they hit you and you ramp up, and then you flip forward and back. What that causes a lot of biomechanical changes in the cervical spine, and you end up with trauma, ripping and tearing of the muscles and ligaments, but also inflammation around the nervous system, which is going to hamper your healing. If left unattended, this will actually progress over time, where you start increasing the reversal of the curve or slanting forward, and also further damage to the discs and to the nervous system. So what we do here is we'd be bringing back your head, putting the curve back into your spine gently, and getting the pressure off the nervous system so your body can heal. Because without the nervous system functioning 100%, you're not going to heal properly. And it takes a lot of time, but it's worth every minute. Both what you do at home and what we do here, because it's a mutual working partnership. If this interests you, please call me, Dr. Robert South at Pike Creek Chiropractic Center. Thank you.